Everyone, welcome back to my YouTube channel. Today I'm going to be doing a simulated nursing education session using two nursing students that have graciously given their time for advancement of our craft. I have Miss Veda here. She's the student that's going to be working with our standardized patient, who is also a student. So we're going to get started, and I hope that everyone learns a lot. Good afternoon. I'm Miss Russell.
I'm Veda. How are you today?
Good. So Veda is our student, and she's going to be getting a quick report on Miss Ross. She is at 7 o'clock in the morning. Miss Ross has been NPO for 10 days, and she is going to be starting her tube feedings. So the report that we got this morning was that after 10 days of being NPO, she's going to start enteral feedings. Our orders are right here for half strength inshore at 25 mLs per hour. Some quick background that I'm going to give Veda is that Ms. Ross had extensive abdominal surgery. She had fibroids removed, and that caused her to have to be intubated for 3 days. She suffered vocal cord paralysis, and that's why the decision was made to feed her with the NG tube instead of letting her eat on her own. Okay? So the vital signs this morning for Ms. Ross are normal. She's afebrile. Her stats are good on room air. She hasn't used pain medication in a couple days. And Veda, she has, as you can see, she's got a nasogastric tube taped at 51 centimeters, according to what the doctor got the x-ray confirmation, and 68 centimeters outside of her body. She's got a PIV in her left wrist. It's just for saline lock. She's alert and oriented ×2. She's a full code. She has no power of attorney and no allergies. Okay, so our recommendation today is for you to check the NG tube using the two methods we learned in lab. What are the two methods we learned?
Check if it's 51.
Check
and then check the length.
Okay, check the length, and what's the other one we learned?
Oh, the pH test.
Yeah. So for the gastric pH has to be less than 4. That's stomach contents are acidic. Okay, good. So we're gonna check it using two methods. We're gonna do a quick abdominal assessment, make sure she's got at least some bowel sounds so she can start feeding. Then we're gonna start the feeding per order. We're gonna reassess her, make sure that she's tolerating it, and it's very important that she keeps her head of the bed at 45 degrees or greater. Okay, so go ahead and do your quick checks, and we'll get the feeding going.
The data for this is at 51 centimeters.
Good.
It's at 60 outside.
Perfect. And we expect the gastric contents to be pretty clear because Ms. Ross hasn't eaten in days. It might be a little bit yellow, but it shouldn't be green, it shouldn't be bilious. And when we're checking, it's less than 4. It's about at a 2, so that's perfect.
I'm just gonna check her stomach.
Ms. Ross, are you excited to eat?
Yeah, I'm feeling kind of hungry.
Oh, okay. Okay, good. So now we're ready to get it going. So your inshore is there. And they mix it for her. It's already mixed at half strength. As Ms. Ross has not eaten in a lot of days, we want to give her a full strength feeding. have that clamped. Oh, clamped is this way. So make sure we're clamping it so when she runs it through, it won't drip all over. So we're gonna fill it up to about the 200 just so she can see what she's doing. Normally you would only put 4 hours worth of feeding into the feeding bag, but we're just doing it to 200 for educational purposes today. So just like we did in lab, squeeze the little chamber first. So you have your fluid going, and then slowly run it through to the tip, and then we'll figure out the drops. Okay. So let it run all the way through to the tip. Okay, so now slow it down, and now we're going to count the drops, and I think that's good for about 25 mLs per hour. Okay, how is it feeling so far? Good?
I feel good.
Okay. All right, we'll be back to check on you. So we're back because we hear the alarm ringing. Veda, what do you think's going on?
I think that's like she's laying down on her side, but she having you pick it up.
She was supposed to be having the head of the bed up. So what are we gonna do now?
We're gonna need to stop this. I'm sweating.
Okay. Okay.
We need to take the feeding tube off of her.
Oh, yeah, the feeding tube moved out, so the 51 centimeters is down here. Okay, so go ahead and take that out. We stopped the feeding. We put the head of her bed up. We got that off. Okay. So Veda came in and she saw some things happening right away, and we've already taken some action. The patient was laying down. She was supposed to be having the head of the bed up, and she's sweating. The feeding tube came out, and her vital signs are abnormal. Her stat was 93 on room air. Her temperature is spiking. Her respirations are up, and her heart rate is 118. So these are all abnormal findings. It could be something happened when she laid down. And what do you think happened? If she laid down and she started sweating, the tube pulled out.
The feeding went into her lungs, and
Yeah.
that's the issue.
So what is that called when it goes into your lungs? Maybe like a little bit of aspiration. Okay. So what are some other things? We already have her a little bit more stable. Her saturation's still down. It's only 85. So what did the doctor order if the sat goes below 95?
The doctor ordered oxygen.
The oxygen. Okay. So the easiest way to put the oxygen on is the nasal cannula. So we've already lifted up the head of the bed to 45 degrees. We removed the NG tube after we realized it was not in the right place. We started administering oxygen with the nasal cannula at 2 liters per the doctor's order. What are some other things that we need to do? Now that she's a little bit more stable, we need to listen to her lungs and see what they sound
And the
like.
bowel movement.
Yeah, so listen to the lungs first and let me know. So pretty, yeah, does it sound coarse?
Yeah.
Yeah, so maybe there's some fluid got into the lungs, so listen to her stomach and let me know. Yeah. So the bowel sounds were like a little bit hypoactive, but they were active. But now on the upper quadrants, they're hyperactive, and in the lower quadrants, they've gone from hyper to absent. So those are not good assessment findings. Okay, so we're just gathering all the data of what we need to do before we call the doctor, right? So we're gonna reevaluate her vital signs. Right now, we have her on the oxygen. She's calmed down her breathing. The sweating has improved. How do you feel now, Ms. Ross?
I feel much better. A little bit of pain. I'm doing good.
What do you think, why did you put yourself on your left side?
So that I can produce some gas movement.
Yeah. But you're supposed to keep your head of the bed up, right?
Yeah.
So what we think happened, we won't know for sure until we call the doctor and get some tests. But we think that the tube slipped out either from you not tolerating the feeding or from you laying on your left side. Either way, the tube slipped out and some fluid got into your lungs. So we are gonna call the doctor and have him check you out, okay? But right now, just stay in the bed, don't get up for now. You're gonna go back to being NPO. We're gonna call the doctor for some orders, okay? So let's fill this out together. We always use the S.L.R format when we are gonna give report to the doctor. So what are we gonna tell the doctor happened just now? The situation, what was the situation? We started the feedings after 10 days. The background that the doctor needs to know, because the doctor we call might not know the background. The background that's important to tell them is that she had abdominal surgery and she was NPO for 10 days. So whoever answers the phone might not know that, so we have to tell them. And then we're gonna relay to the doctor our assessment findings. So what are you guys gonna tell the doctor what you found wrong with her while you're calling?
Increased WOA.
Yeah, so you were having a hard time breathing, sweating. She was sweating, diaphoretic,
Tube pushed back.
her tube slipped out. She was having the increased work of breathing. We can't diagnose as nurses, but we can come up with clues that the increased work of breathing, the sweating, and all of that, and the tachypnea, and the decreased saturation probably was a mini aspiration into the lungs, right? So we're gonna tell him the assessment findings. It's up to the doctor to make the diagnosis, but we tell them what we found. So we found her sweating, we found her tachypnic, increased work of breathing, low saturation, requiring oxygen, and not tolerating the feedings, okay? She has extreme abdominal pain, whereas before she was hungry and ready to start eating. Now she's having extreme abdominal pain. So not only does she have a little mini aspiration, she probably has something going on in her belly why she's not tolerating just a very little bit. Because we were just here an hour ago and only maybe 50 cc's went in. So what are some things that, what are some things you think the doctor might order? And it's not up to us to come up with the doctor's orders, but it is nice to just anticipate what the doctor might order. So she's not going to be able to eat, so what do you think he's going to have to order for her IV?
For my IV?
Yeah, because you're not going to be able to eat, so we're going to have to hang something. So probably just hang a bag of sugar water until we figure out what's going on. How are we gonna look at your chest and your abdomen? Yeah, so only an X-ray can see inside to see what's going on in your stomach. The doctor probably will order some blood work, and these are already standing orders for emergency. When we got off the phone after our S.L.R report, he ordered that we can titrate the nasal cannula down. If she's tolerating it, we can take it off, but right now she's not gonna be able to eat. And he ordered some blood work, so just pass me those things over there. So we're not actually going to stick our standardized patient, but this is what the doctor ordered: CBC, CMP, and a culture and sensitivity. And so I know it's a lot to put together as nursing students, but this is what we just try to do, is recognize signs of deterioration and respond appropriately. So you did very good coming in and very quickly sitting her up and stopping the feeding and helping her to improve. And that is all what we want to do with simulation education, is to be able to recognize her vitals went from normal to abnormal, her assessment findings went from normal to abnormal, and we did some basic nursing interventions to help her, okay? How'd you guys feel like the session went?
I feel like it went good. I learned a lot of valuable information.
Okay, and for those of you that are going to be watching the video at home, the patient's diagnosis is gastric ileus after abdominal surgery. It's very common. Okay, thank you so much.